Hello and welcome to Dr. Sushant's anatomy tutorial. In this video, I'm going to show you the contents of the popliteal fossa. The popliteal fossa contains so many important structures. One of the important structures here is the popliteal artery to begin with. The popliteal artery is actually a continuation of the femoral artery as it passes through the fifth osteoperoneuritic hiatus of the adductor magnus muscle. The artery passes vertically in the popliteal fossa and it terminates at the lower border of the popliteus muscle by dividing into anterior and posterior tibial arteries. The popliteal artery gives you genicular branches in the popliteal fossa, which are named as the superior lateral, superior medial, inferior medial, middle genicular arteries, which are actually going to contribute to the anastomosis around the knee joint. The popliteal artery is accompanied by the popliteal vein. The popliteal vein is this and commences at the lower border of the popliteus muscle by the joining of the vena comitans of the anterior and posterior tibial arteries. And the popliteal vein terminates by continuing upwards as the femoral vein at the fifth osteoperoneuritic hiatus of the adductor magnus muscle. The popliteal vein receives the termination of the small saphenous vein or the short saphenous vein. This highlighted vein is the small saphenous vein, which commences from the lateral end of the dorsal venous arch. It pierces the roof of the popliteal fossa before it terminates into the popliteal vein. Now, the other contents of the popliteal fossa are the two terminal branches of the sciatic nerve. The two terminal branches of the sciatic nerve are the tibial nerve, which passes from the superior angle of the popliteal fossa to the inferior angle of the popliteal fossa, meaning vertically downwards. And the second terminal branch is the common peroneal nerve, which is this, and it passes from the superior angle to the lateral angle of the popliteal fossa. Another nerve that we encounter in the popliteal fossa is the posterior femoral cutaneous nerve, also known as the posterior cutaneous nerve of thigh. Sometimes we will also find the genicular branch of the posterior division of the obturator nerve as well in the popliteal fossa. Now we are left with these small beaded structures known as the lymph nodes. Since they are present in the popliteal fossa, they are known as the popliteal lymph nodes. All these structures of the popliteal fossa are embedded within what is known as the popliteal pad of fat, and the contents of the popliteal fossa will be exposed when you separate the boundaries of the fossa, especially the two heads of the gastrocnemius